Caring for our grandparents is everyday love. This short video module shows simple and practical steps Gen Z caregivers can follow when accidents or health concerns happen at home. Care starts with awareness and readiness. This video will help you understand the basic home first aid practices, learn how to prepare and maintain a first aid kit, recognize warning signs that need professional help, and stay calm when emergencies happen. So, what should be in a first aid kit? So, for the basics, you will be needing rubbing alcohol, thermometer, BP monitor, antiseptic and cotton swabs, burn ointment, gauze, adhesive tape, and bandages, distilled water, sterile gloves, small medical tools such as scissors and tweezers, medical tape, and hot or cold packs. Do also include essential medications, both maintenance and over-the-counter. Always label them clearly and store properly. When giving medication, remind others to read the product guide or consult their pharmacist. Keep a complete first aid kit in an easy-to-reach, clean, and dry place. Check it monthly and replace expired items. Arrange medicines into labeled pouches and set a monthly reminder to check for expiry dates. If your grandparent feels dizzy, have them sit upright and move slowly. Encourage water intake and avoid caffeine, alcohol, and tobacco. Observe aspiration precautions while eating or drinking. If dizziness is sudden, persistent, or paired with other symptoms, consult a healthcare professional. A fever isn't always really bad for adults. It's the body's way of fighting infection. Use a tepid sponge bath, offer fluids, and let them rest. If the temperature reaches 37.8 degrees or higher, you may give paracetamol as needed and consult a doctor if symptoms persist. You can relieve fever by giving a tepid sponge bath, increasing fluids, letting them rest, and taking paracetamol when needed. Avoid giving multiple medicines without professional advice. Follow these steps for minor cuts and wounds. Wash your hands first, clean under running water and soap. Pat dry and wipe from center out using gauze or antiseptic like povidone iodine. Use a fresh pad each time. Cover with clean dressing and raise the area. Seek medical care if there's infection, a foreign object, or tetanus risk. When a fall happens, stay calm and don't move the person too quickly. Check for pain or bleeding and guide them to a sturdy chair if possible. If there's head trauma or a bump on the head, go to the nearest emergency room for a CT scan. If they can't go immediately, observe them for 24 to 48 hours for any warning signs and seek help at once if symptoms appear. Always keep a charged phone or emergency contact device nearby. Wrong medication can cause harmful effects, so call a doctor or a pharmacist immediately. For missed doses, if it's less than 2 hours have passed, take it now. If more, wait for the next schedule. Never double dose to make up for missed ones. Check blood pressure and temperature at the same time daily and record them. A BP reading consistently above 140/90 needs a checkup. If it rises to 180/120 or more, seek emergency care immediately. Remember, prevention is easier than emergency. So, when should you seek for professional help? Call emergency services if your grandparent is unresponsive, has trouble breathing, chest pain, severe bleeding, or sudden loss of balance, vision, or speech. Also for choking, vomiting blood, swallowing poison, or severe pain. In the Philippines, you can call 911 or contact your local barangay for ambulance services. For emotional readiness and self-care, stay calm and breathe deeply. Speak gently to reassure your loved one. Call for help confidently. When needed, knowing when to ask is part of being a good caregiver. Take breaks when you feel overwhelmed and focus on what you can do. When calling for help, state your full name, exact address, and what happened. Give your contact number and any known conditions or medications of your grandparent, so responders can act quickly and safely. For the final checklist, keep your first aid kit complete, do daily health checks, stay calm, and know when to call for help. Care isn't just about what you do, but also about how you do it. In every small act of readiness and calm response, you show love that speaks louder than words, because care begins and ends with connection with the hands that hold, the hearts that listen, and the love that stays. Hawak Kamay, Alaga 101.